their lunch.
Cars and coffee, plastic surgery and lunch.
There you go. Lipo and lunch.
There you go.
I don't know if everyone can watch. Hello guys, thanks for joining us. Happy Monday everyone. Hope everyone's having a great day so far. We are live in San Antonio, Texas with Dr. Barlow, aka Dr. Rocket, and we are working on our the case right now that we're doing is going to be Lipo 360. She's doing BBL. No, just tummy tuck. Tummy tuck. Okay, got it. So she's doing a breast augmentation and lift. She's doing Lipo 360, and she's doing some lipo to her inner thighs as well. I was like, did I read that? And tummy tuck. With Selfina, guys. Please feel free to ask any questions. I see some of you on YouTube as well, so you can see the whole thing going on. Feel free to ask any questions. If you have any questions for any of us, we'd be happy to answer them. Pre-operative care, post-operative care, plastic surgery questions. And if you guys have questions about our pricing, promotions, anything we have going on right now, you can fill out the form in the bottom left corner. And every few minutes, I'll pin on the screen the form as well to make it easier for you guys to fill out that form. We are in San Antonio, Texas. In the Stone Oak area. Guys, we are showing this on YouTube as well. I see some people are on there, but you can find the link in our bio for our YouTube channel, and you can see the entire surgery happening versus just seeing my face or Dr. Barlow's face. You're actually able to watch the entire procedure. We like doing that for kind of documentary style, just kind of seeing everything we do, the work we do, how we do it. And you can ask your questions on there too on our comment section. Thank you for the follow, Britt. Where is everyone joining us from today? Thank you for the follow, Kathy. PGH. Is that Pittsburgh? Where is PGH? San Antonio, Texas. Oh, Grandma Vicky's from San Antonio. Hogansville, Georgia. That's cool, Kathy. I don't think I've driven through Georgia. I don't think I've stayed in Georgia though. Yeah, okay, great. Pittsburgh. South Carolina. Okay. It's now officially fall, so we'll have more of our fall specials coming up. Plastic surgery and pumpkin spice lattes. Arizona. George, I didn't realize how big Arizona was until I had to drive through it recently, and I felt like I was gonna be in Arizona forever. Yes, so we are showing, we're doing a surgery right now. We can only show certain things on TikTok and Instagram, Facebook. It doesn't allow us to show any of the details of the surgeries. But if you want to go to our YouTube channel, which is in the link in our bio, you can head over to our YouTube channel and you can see the actual surgery happening versus just me talking on the surgery. We're on here to just answer questions. For TikTok, we answer questions on here during the surgery, and can guide people to our YouTube channel when we do, so you can watch it. Thank you for the follow, Michaela. Oh, awesome, Kay. Thanks. Kay from England says she loves your videos.
From England?
Yes. My dad was an ENT and plastic surgeon. Awesome. Yeah, that's pretty cool. It's very cool to be a part of this and watch all these surgeries going down, watch people's bodies change, confidence boost. Kay, Dr. Barlow is asking, what part of England are you from? Do you live in? Kent. For those of you just joining us, we are live in San Antonio, Texas with Dr. Barlow, aka Dr. Rocket. And we are doing a lipo 360, we're doing a breast augmentation and lift, we're doing a tummy tuck, she's doing selfina and some lipo to the inner thighs. And we are here to answer any questions you guys have. Anything about pricing, promotion specials, you can fill out the form I've pinned to the screen. And anything you've always wanted to know and never had the opportunity to ask, feel free to ask on here. Thank you for the follow, Miss Angela. Oh, thank you, Kay. That's very nice. She says she always watches the videos when she gets a chance. I have never been to England, but I would love to go. Yeah, my mom is actually moving to Italy in about 3 months. Yes. She's doing missionary work over there. In the surrounding areas, but their home base is gonna be in Italy. I know him. What'd you say? Yes, yeah. I've never been to Italy either, and I'm like, oh, well, now I have a place to stay. I'm jealous. That's pretty cool. I don't know. I think it's a couple years at least, but yeah, I'm real curious to know how she's gonna do, because she has several grandchildren and they're her life, and so I'm not sure how long she'll be able to get. But they've been in seminary school for. She's graduated in the spring. Yeah. They're in Fort Worth right now. Thank you for the follow, Ronald. Bay City. Nice. Thank you for the follow. Thanks for the follow, Harley. Appreciate that. Guys, feel free to drop your questions in here. We are happy to answer any questions you have. Right now we're doing the lipo portion of her procedure on the back. And then we'll move to the front and do all the lipo, tummy tuck, the breast portion with her lift and her implants. How big is she going today? How big is she? I'm all over here. She's going 350 cc's on both sides. Yeah. Nice. She's going up about a cup size, he was saying. Have some more people hopping over on YouTube. Thank you guys for joining. Tammy, hi, how are you? Pumpkin, hello. Colin, thank you for joining. Allie, thank you for joining.
Hello, Pumpkin.
I know, what a perfect name for fall. I live over in Bulverde, and there's a little animal rescue over there, farm animal rescue, and they just got all these pumpkins they went 7 hours north to bring them down, so I think the kids will probably do pumpkin patch this weekend. I'm wondering if my animals will eat pumpkins. Yeah. And it's, everything you buy goes to their organization, so. Because I have chickens, I have 10 chickens and a pig and a horse, but I wonder if my chickens, I've seen on TikTok and stuff that they'll be like pumpkin carving with chickens, and they'll cut like kind of the rough shape of it, and then they'll peck at it to get the holes go through. But I don't know if my chickens will do that. I hope so. I know. Yeah, we accidentally have a rooster that was not on purpose, but he's not mean. He's yes. Well, so we got a so that's what I'm going through right now. Hold on, we have a question here. So Roman says, how often does a plastic surgeon need to be recertified? Board certifications, how often? Every 10 years? Every 10 years for the board certification. All of our doctors are board certified. All of our anesthesiologists are board certified. But they're constantly also reading and doing all kinds of CE courses and things like that to just stay on the trends and know the best way to do it. Oh, they just had a meeting. Okay. They just had their meeting this weekend. If you fail, can you try again? When you fail the board the first time, you can redo it, yes. What's the best way to answer this one? It says, I don't think it's great to have TV or social on surgery for contaminations and infection in the environment.
There's really no increased contamination risk because you're so far away from the patient.
We stay away from all the sterile areas. We never come close to it. Yeah. So this is just our opportunity to kind of educate people and show them, and we don't get near anyone who's touching the patient or serial areas are scrubbed in. We're just off in the corner. Like right now I'm zoomed in. If I zoom out, you'll see how far I am. There you go.
Very, very careful with humidity.
Yes. But yes, my rooster is of age now where he does not leave the hens alone. And the problem is that some of them have been sitting in the coop for longer than, it takes 21 days for eggs to hatch, and it's been longer than that, so I don't think they're living. And I don't know which ones are living, which ones aren't, so I'm like, I don't know what to do. I don't know what's happening. Well, when you candle them, if they're almost to term, but they're not living anymore, it'll still show. So I don't know what to do, because I feel like I'm throwing them out. I asked the feed store too, because they all have chickens, and they were like, you're kind of out of luck. You gotta just hope for the best. And I'm like, oh no. I don't know. I'm gonna feel bad if they're viable. No, it's when I leave to drop the kids to school. So it's like I start to hear about when I'm getting them breakfast and stuff. So that's, yeah, it's probably about 6. I'm up, yes, when on the weekends it's a little different when I want to sleep in, or he thinks he's tough, but he's not mean. He's what's called a silky breed, so they're about half the size of a normal, like what you'd normally see as a chicken. Yeah, so, but you can't sex them when they're babies. You have to guess. So I did my best trying to figure out the wings and stuff, but I picked out 4 and I got 1 wrong. Do what? No, I think, you know what? I think my neighbors do, but I can't say for certain because they're 30 acres back. So I hear a lot of stuff at night on the weekends sometimes. I'm like, Roman says, I've been fascinated with plastic surgery since Dr. 90210. The plastic surgery it's very interesting for sure. I love watching this stuff. Natika, yes. Well, not me, obviously. I'm just helping with the social media, but Dr. Barlow is. Oh, yeah. The face ones are going to be a little bit hard to watch sometimes. Thank you for the follow, Just Jamie. Thank you for the follow, Sister Golden Hair. They can all choose their different styles of music they want playing in the operating room. Thank you for the follow, Dennis. Can I have surgery after a blood clot complication?
Depends on what the clot started.
How the clot started, what the right. Are you on blood thinners now? We do blood work before every procedure to make sure you're in good health and make sure you're a good candidate for going under and getting surgery in general. So, and we do monitor the time with our board certified anesthesiologist is always monitoring. So we make sure everything from start to finish, post-op, everything is just spot on. So you're in the best care. She said yes, she is on blood thinners. Okay, talk to your hematologist. Qualified, yeah, get a yes from him and then come in here and get a yes from us, and that you're in good health and will be a candidate. Yeah, Atika, sometimes, so we'll talk about the surgery and we'll get questions in here, and then sometimes we'll say where we're from, San Antonio, just the same things over and over, and we'll talk about all different kinds of topics. Guys, we do have some September specials going on right now, so if you want to learn more about those and our different financing. We have a ton of financing options. Some financing options that go up to almost 10 years in financing, and some that are, you know, over a couple years. So if you would like to fill out the form I just pinned to the screen and learn more, our team can call you. They can also text you if you're at work and get in touch with you later. But feel free to ask your pricing questions on there. Oh, she says she's in Houston and she can't travel. I guess not. Okay, I'll do that. Let me screenshot this so I have your username for later, and we'll send some information. She's just asking for more information anyway, so. Thank you for the follow, Jackie. For those of you just joining us, we are live in San Antonio, Texas with Dr. Barlow, also known as Dr. Rocket. And we are doing Lipo 360. We're doing a tummy tuck. We're doing some lipo to her inner thighs with Selfina. We're doing a breast augmentation with a breast lift. And we are here to answer any questions you guys have. We are showing this on YouTube, so if you want to check out the link in our bio, you can go to our YouTube channel and see the entire surgery happening. Okay, great. Dora, I see you on here. I sure will. When we get off the live, I will send some information to you. If you wouldn't mind, Dora, would you be able to fill out in the bottom left corner, there's a little blue button. If you could click that and fill out your info, I'll hand it over to our team. Yes, on our social media pages we do, Teresa. Just Jamie, are you not allowed to say because of privacy rights? Are we not allowed to say which part? Oh, maybe I missed it. And sometimes they don't always go through. So let me look and see if I can find your question. And then I don't see your questions. If you're able to ask again, then I can. I don't know why, but sometimes it filters them out. So try asking again, and I'll see if I can see it this time. Yeah, sometimes certain words will trigger it, so maybe ask it in a way you think would allow to be on here. Kathy asks, she says, I am already set for arms, breast reduction, and implants, but wonder how wrapped for the first week or so. Kathy, are you asking how long you'll be wrapped for after the breast, after the implants and reduction? Is that what you're asking? What type or how? So arm lipo or a lift. That way we can get all the details.
You gotta text them, hey, I'm Phil, you want to do any questions? I don't know either.
Kathy, were you saying for just the breasts on the wrap, or like for all of the whole thing? Okay, just Jamie, all I see right now is rocket. She's trying to type her question and she corrected it and just wrote rocket, but all I see is the asterisk rocket. I'm doing both at the same time. I need to know what I'll look like. Will I need help? Oh, okay. So Kathy's asking, she's set up for arm breast reduction and implants, and she's wondering how the bandaging will look, if it's something she'll need help with or she can manage it herself. Give us 1 second, Kathy.
Good that you don't.
I know for a couple months.
So you did have any issue with anesthesia?
Not my personal, that's really
She said for her arms, her breast reduction and implants. That's what I was trying to ask. Are you doing lipo or a lift on your arms? Harriet, thank you for the follow on TikTok.
And they're similar. We usually do a strap with maybe easier to have someone over that.
Yeah, it's a lift. Okay, she's doing arm lift.
Yeah, it's probably
Oh, good for you, Kathy. She lost 320 pounds. That's amazing. Congratulations. So Dr. Barlow is saying he suggests you have some help with it. I think you could, then correct me if I'm wrong, but they could also set up nurse appointments if they need help, right? So you could set up additional nurse appointments if you needed help and you didn't have that help at home, or a friend or someone that could help you. They could always help you. The nurses can help you. Tanisha, I got my breast implants done 11 years ago. I'm not having any problems, but how far after do you have to get them looked at to make sure there's no issues?
If there's no changes at all, odds are really good there's nothing wrong.
Tanisha, if there's nothing going on at all and they look the same, feel the same, you're not having any issues, and there's probably nothing going on with them, and you can keep them in until you feel you want to change them, or if you ever have issues with them.
Everything used to have a 10-year warranty, so it's a push of 10 years to swap them out.
Oh, Kathy says her stepdad is helping, but because of the surgery, she feels weird with that. Yeah, I understand. So I would say then probably maybe make the nurse appointments, or see if you can find like a girlfriend to help you or something like that. Thank you for the follow, Mama W. Yeah, Tanisha, we see people who don't have them replaced for longer than that, so no worries. Mine are probably about the same, probably 11 years old also, and I don't have any issues, so.
That's when the exams and MRI.
If you worry about it or it makes you feel uneasy, you can always get an MRI done. But if you don't feel anything, you know, your body generally tells you when something's wrong, or you know your body, you can see it. So yeah. Do you? I used to have more, but when my ex and I split, I lost the other one, so I only got to keep the one that was only mine. So, what kind do you have? Okay. Oh. Yeah. Yeah. Oh, that's great. My kids will get on Wyatt, but they don't do it as often as I'd like them to. He's a thoroughbred. He was an off track. I got him from a rescue in New Braunfels. Yeah, he was only $700, and he's like the best horse I've ever had. Okay, sounds good, guys. We're gonna go ahead and flip, and then we'll come back on. We're gonna flip the patient to the front. Thank you for the follow, Julie, and I'll see you guys soon.